This next topic has really been, I think, I want to say a hot topic, but especially for those of you who are maybe involved in the healthcare systems collaboratory that NIH is operating around pragmatic clinical trials. And it's turned out to be an area where there needs to be a lot of work and thoughtful deliberations if we're to achieve some of our goals. This session is going to be moderated by Barbara Bierer from Brigham and Women's. She's a senior vice president for research and a professor of medicine at Harvard Medical School, and she will introduce the panelists.
Thank you, and thank you for allowing us this opportunity, and thank you to the IOM for having us here. You know, I thought that I'd just say a couple of words. The reason that we're having this session today is to dissect the regulatory and in part ethical framework around the kind of work that we're talking about today. As we heard this morning when somebody talked about the role of the IRB, the answer was the IRB is an impediment. That was the end of the answer. So we thought we might annotate that answer just a little bit and move forward in a more positive direction, hopefully. I also thought that as we begin to think about the continuum of research to practice or practice to research and how that works, it's important to remember that in the regulatory guidelines of OHRP, the common rule, research is defined as a systematic investigation including research, development, testing, and evaluation design to develop or contribute to generalizable knowledge. In other words, if you do the same experiment as a QI experiment, in quotes, QI project internally, if you know you're going to publish it and make that generalizable, the exact same thing is subject to regulatory oversight. So, so that's what we're going to be talking about, and how to reframe that conversation and whether there are regulatory barriers to doing the kind of work that we've been talking about this morning. I do want to say that I found this morning and early afternoon fascinating, but embedded within the conversation were lots of different models and kinds of research. We talked about randomized clinical trials, clustered randomized trials. We also talked about sort of systems improvement, or how to optimize medical homes, and how to look at implementation science, which is very different than if you're comparing two drugs, even standard of care drugs, against each other. I think what's been off the table, and I would presume off the table for all of us here, is any FDA-regulated trial, anything that's under the jurisdiction of the FDA as a test article. So that part is pretty clear. For all of us, we think that requires informed consent. Beyond that, I think that it's going to be a robust discussion. And importantly, in one of the three principles, there has not been of justice, respect for persons, and beneficence. There has never been a call for public health. And I think that's the position that we need to think about today. And with that, I'd like to introduce my panel. Nancy Cass from Johns Hopkins University is the Phoebe Berman Professor of Bioethics and Public Health in the Department of Health Policy and Management, Johns Hopkins Bloomberg School of Public Health, and Deputy Director for Public Health in the Berman Institute of Bioethics. Her current research projects include ethics for learning healthcare systems, including quality improvement, comparative effectiveness, informed consent in randomized trials, ethical issues that arise in international health settings, and ethics in public health preparedness. Nancy will give the major introductory talk, and then we're going to have a panel with discussion of oversight challenges. Susan Huang from the University of California at Irvine was introduced this morning and spoke eloquently at that time. Jim Weinstein at Dartmouth-Hitchcock is Chief Executive Officer and President of the Dartmouth-Hitchcock Health System including New Hampshire's only academic medical center and a network of clinics across Vermont and New Hampshire, serving a patient population of 1.5 million. Under his leadership, it's worth mentioning that Dartmouth-Hitchcock is working to create a sustainable health system for patients, providers, payers, and communities. And lastly, Peter Margolis from Cincinnati Children's is Professor of Pediatrics and Director of Research at James M. Anderson Center for Health System Excellence at Cincinnati Children's Hospital Medical Center. And he also looks at quality improvement in a broad area of research, communities, public health settings, and will comment from that perspective. Nancy?